What are the 6 rights of medication administration in EMS?
Right patient, right medication, right dose, right route, right time, right documentation.
Define indication in pharmacology.
A condition or situation for which a drug is appropriate to give.
Define contraindication in pharmacology.
A condition or situation in which a drug should not be given.
Define side effect.
An unintended, usually undesired, effect of a medication at normal dosing.
Define untoward effect.
An unexpected or dangerous side effect of a medication.
What is the generic name of a drug?
The official, non-proprietary chemical name, e.g., acetylsalicylic acid.
What is the trade name of a drug?
The brand name given by the manufacturer, e.g., Bayer for aspirin.
What does route of administration mean?
The pathway by which a drug enters the body, e.g., oral, IM, sublingual.
Name the route, drug placed under the tongue.
Sublingual.
Name the route, drug sprayed or inhaled into the lungs.
Inhalation/nebulized.
Name the route, drug given by swallowing.
Oral, PO.
Name the route, drug injected into muscle.
Intramuscular, IM.
Name the route, drug given via rectum.
Rectal, PR.
What does onset of action mean?
The time from administration until the drug begins to take effect.
What does duration of action mean?
The length of time a drug remains effective.
What is a drug's mechanism of action?
How the drug produces its effect on the body at a cellular/molecular level.
What medications does an EMT basic typically carry on the ambulance?
Oxygen, oral glucose, aspirin, and, per protocol, activated charcoal.
What patient assist medications may an EMT help a patient self-administer?
Nitroglycerin, epinephrine autoinjector, and metered dose inhaler, albuterol.
What must an EMT confirm before assisting with a patient's own prescribed medication?
It is prescribed to that patient, is the correct medication, and has not expired.
What is an autoinjector?
A spring-loaded syringe device that delivers a pre-measured dose of medication through clothing/skin.
What is a metered dose inhaler, MDI?
A handheld device that delivers a measured dose of aerosolized medication to the lungs.
What does PRN mean on a medication order?
As needed.
What does NKDA stand for?
No known drug allergies.
Why must an EMT ask about allergies before medication administration?
To avoid triggering an allergic or anaphylactic reaction.
What is anaphylaxis?
A severe, life-threatening systemic allergic reaction.
What does naloxone do pharmacologically?
It is an opioid antagonist that reverses opioid effects by competing for opioid receptors.
What is a drug agonist?
A substance that binds to a receptor and activates it, producing a biological response.
What is a drug antagonist?
A substance that binds to a receptor and blocks it without activating a response.
Why do EMS protocols require medical direction for certain medications?
To ensure appropriate use and legal authorization under the EMT's scope of practice.
What is offline, standing order, medical direction?
Pre-approved protocols allowing treatment without direct physician contact at the time of care.
What is the medication classification of oxygen?
A gas classified as a medication, administered for hypoxia.
What is the primary indication for supplemental oxygen in EMS?
Suspected or confirmed hypoxia or hypoxemia.
What device delivers approximately 24 to 44% oxygen at 1 to 6 liters per minute?
Nasal cannula.
What device delivers approximately 90 to 100% oxygen at 10 to 15 liters per minute?
Non-rebreather mask.
What flow rate is used with a non-rebreather mask?
10 to 15 liters per minute, enough to keep the reservoir bag inflated.
What flow rate range is typical for a nasal cannula?
1 to 6 liters per minute.
What device is used to ventilate a non-breathing patient with supplemental oxygen?
Bag valve mask, BVM.
What oxygen flow rate is typically used with a BVM?
15 liters per minute or higher, often with a reservoir attached.
Should oxygen ever be withheld from a hypoxic patient in EMS?
No, oxygen should not be withheld from a patient who needs it due to hypoxia.
What SpO2 reading generally indicates the need for supplemental oxygen?
Below 94%, per current guidelines, or per local protocol.
What is a potential risk of high-flow oxygen in some COPD patients?
Blunting of hypoxic respiratory drive, though this should not delay needed oxygen therapy in acute hypoxia.
What are signs of hypoxia an EMT should assess for?
Cyanosis, altered mental status, tachypnea, and tachycardia.
Is oxygen considered safe to administer to almost all EMS patients?
Yes, oxygen has very few contraindications and is a mainstay of EMS treatment.
What is a Venturi mask used for?
Delivering a precise, controlled percentage of oxygen.
Why is humidified oxygen sometimes preferred for prolonged transport?
To prevent drying of mucous membranes and patient discomfort.
What is the generic name for oral glucose gel?
Glucose, dextrose in oral gel form.
What is the indication for oral glucose administration?
Suspected hypoglycemia in a conscious patient able to swallow/protect airway.
What is the major contraindication to oral glucose?
Unconsciousness or inability to swallow/protect the airway.
What is the typical adult dose of oral glucose?
1 tube, approximately 15 to 25 g, administered buccally.
What is the route of administration for oral glucose gel?
Oral, placed between cheek and gum, buccal.
What blood glucose level generally indicates hypoglycemia in adults?
Below 60 to 70 mg/dl, per local protocol.
What are signs/symptoms of hypoglycemia?
Altered mental status, diaphoresis, tachycardia, weakness, and confusion.
What mechanism explains oral glucose's effect?
It provides a rapidly absorbed simple sugar to raise blood glucose levels.
What must an EMT assess before giving oral glucose?
The patient's ability to swallow and protect their own airway.
Why is oral glucose given buccally rather than swallowed whole?
For faster mucosal absorption and reduced aspiration risk in a marginally alert patient.
What side effect might oral glucose cause?
Generally minimal, possible nausea.
What condition commonly causes hypoglycemia in known diabetics?
Excess insulin or oral hypoglycemic use relative to food intake or exertion.
What action should an EMT take if a hypoglycemic patient is unconscious?
Do not give oral glucose, secure the airway and transport, for dextrose per ALS if available.
What form does oral glucose typically come in for EMS use?
A gel tube, e.g., Glucose, Instaglucose.
Can oral glucose be used for altered mental status consistent with hypoglycemia but unknown glucose level?
Yes, per protocol if the patient can protect their airway and swallow safely.
What is the indication for activated charcoal administration?
Certain oral poisonings/overdoses, per medical direction and toxin type.
What is the primary contraindication to activated charcoal?
altered mental status/inability to protect airway, or ingestion of acids, alkalis, or hydrocarbons.
What is the typical adult dose of activated charcoal?
Approximately 25 to 50 g, 1 g/kg, mixed as a slurry.
What is the route of administration for activated charcoal?
Oral.
What is the mechanism of action of activated charcoal?
It absorbs certain toxins/drugs in the GI tract, preventing systemic absorption.
Why is activated charcoal not given for acid or alkali, caustic, ingestions?
It does not bind these substances well and can obscure endoscopic evaluation of burns.
Why is activated charcoal not given for hydrocarbon ingestions?
Risk of vomiting and aspiration causing chemical pneumonitis, with limited benefit.
What side effect is common with activated charcoal?
Black stools, possible vomiting.
Has activated charcoal use by EMTs become less common in modern protocols?
Yes, many EMS systems have removed it from EMT scope due to limited pre-hospital benefit evidence.
What must be true of a patient's mental status before giving activated charcoal?
The patient must be awake, alert, and able to protect their airway.
What does activated charcoal look like?
A black, gritty suspension/slurry.
Why must medical direction often be contacted before giving activated charcoal?
Because appropriateness depends on the specific poison ingested and timing.
What time window after ingestion is activated charcoal generally most effective?
Within about 1 hour of ingestion.
What is a risk if activated charcoal is aspirated?
Aspiration pneumonitis.
Does activated charcoal work for all types of poisoning, such as iron, lithium, or alcohols?
No, it does not effectively bind certain substances like metals, iron, lithium, and alcohols.
What is the generic name for aspirin?
Acetylsalicylic acid, ASA.
What is the indication for administering aspirin in EMS?
Suspected acute coronary syndrome, ACS/cardiac chest pain.
What is the standard adult dose of aspirin for suspected ACS?
160 to 325 milligrams chewed, commonly 481 milligrams baby aspirin.
What is the route of administration for aspirin in EMS?
Oral, chewed rather than swallowed whole, for faster absorption.
What is the mechanism of action of aspirin in ACS?
It inhibits platelet aggregation, antiplatelet effect, reducing clot propagation.
Name a contraindication to aspirin administration.
Known aspirin allergy.
Name another contraindication to aspirin administration.
Active GI bleeding or a bleeding disorder.
Should aspirin be given to a patient with suspected stroke?
No, aspirin is not indicated for suspected stroke by EMTs due to hemorrhage risk.
Why is aspirin chewed rather than swallowed for cardiac chest pain?
Chewing increases surface area for faster buccal/GI absorption and quicker onset.
What drug class does aspirin belong to?
NSAID, nonsteroidal anti-inflammatory drug, with antiplatelet properties.
What side effect of aspirin should an EMT monitor for?
GI upset, bleeding, or allergic reaction.
Why should aspirin generally not be given to children?
Risk of Reye's syndrome.
Can aspirin be given if a patient already took their own aspirin at home?
Yes, but total dose should be considered per protocol/medical direction.
What is the goal of giving aspirin early in suspected MI?
To reduce mortality by limiting clot formation/propagation in coronary arteries.
What form of aspirin is preferred in EMS, chewable or enteric coated?
Chewable, non-enteric coated, for faster onset.
Should aspirin be withheld if the patient is already on a daily aspirin regimen?
No, additional aspirin is still generally given per protocol unless contraindicated.
What assessment finding might make an EMT hold aspirin administration?
Signs of active bleeding or a clear allergy history.
What mnemonic is often used for early cardiac chest pain care that includes aspirin?
MONA, morphine, oxygen, nitroglycerin, aspirin, morphine is ALS only.
What is the indication for nitroglycerin administration?
Suspected cardiac chest pain/angina with a prescribed history and adequate blood pressure.
What is the typical dose of sublingual nitroglycerin tablet or spray?
0.4 milligrams, 1 tablet or 1 spray.
What is the route of administration for nitroglycerin in EMS?
Sublingual, tablet or spray.
What is the mechanism of action of nitroglycerin?
Vasodilation of blood vessels, reducing cardiac preload and myocardial oxygen demand.
Name a contraindication to nitroglycerin administration.
Hypotension, SBP less than 100 millimeters of mercury, or per protocol threshold.
Name another contraindication to nitroglycerin.
Recent use of a phosphodiesterase inhibitor, e.g., sildenafil, within 24 to 48 hours.
Name a third contraindication to nitroglycerin.
Head injury or suspected increased intracranial pressure.
Name a fourth contraindication to nitroglycerin.
Suspected right ventricular, inferior wall, myocardial infarction.
What must an EMT verify before assisting with nitroglycerin?
It is prescribed to the patient has taken it before, and blood pressure is adequate.
What vital sign must be reassessed before each nitroglycerin dose?
Blood pressure.
What is the maximum number of nitroglycerin doses an EMT can typically assist with?
Up to 3 doses total, 5 minutes apart, per protocol/medical direction.
What common side effect does nitroglycerin cause?
Headache, hypotension, dizziness, or flushing.
What position should a patient be in after receiving nitroglycerin?
Sitting or supine, to reduce fall risk from hypotension.
How should nitroglycerin tablets be stored?
In their original dark glass container, protected from light, heat, and moisture.
What sensation indicates a nitroglycerin tablet is still potent?
A burning/tingling sensation under the tongue.
What form of nitroglycerin besides tablets is commonly prescribed?
Sublingual spray.
What effect does nitroglycerin have on blood pressure?
Lowers blood pressure due to vasodilation.
Why is nitroglycerin dangerous when combined with erectile dysfunction medications?
The combination can cause severe, profound hypotension.
Should nitroglycerin be swallowed?
No, it should be administered sublingually, not swallowed.
What effect does nitroglycerin have that can relieve angina pain?
Reduces myocardial oxygen demand by decreasing preload and dilating coronary arteries.
If a patient's chest pain is unrelieved after nitroglycerin, what should the EMT suspect?
Possible ongoing myocardial infarction requiring further ALS/hospital care.
What minimum systolic blood pressure is commonly required before giving nitroglycerin?
Generally at least 100 to 110 millimeters of mercury, per local protocol.
What is the indication for epinephrine autoinjector use?
Anaphylaxis or severe allergic reaction.
What is the adult dose delivered by an EpiPen?
0.3 milligrams IM.
What is the pediatric dose delivered by an EpiPen Junior?
0.15 milligrams IM.
What is the route of administration for an epinephrine autoinjector?
Intramuscular, IM, typically lateral thigh.
Where on the body is an epinephrine autoinjector typically administered?
The lateral mid-thigh.
What is the mechanism of action of epinephrine in anaphylaxis?
Alpha and beta adrenergic stimulation causing vasoconstriction, bronchodilation, and increased cardiac output.
Name a contraindication to epinephrine autoinjector use.
None absolute in true anaphylaxis. It is life-saving and should be given.
What are signs/symptoms of anaphylaxis requiring epinephrine?
Hives, swelling, difficulty breathing/wheezing, hypotension, and throat tightness.
Can epinephrine be given through clothing via autoinjector?
Yes, most autoinjectors can be administered through light clothing.
What side effects might occur after epinephrine administration?
Tachycardia, anxiety, tremors, and palpitations.
How long should the autoinjector needle be held in the thigh after triggering?
About 3 to 10 seconds, per device instructions.
Can an EMT assist with a second dose of epinephrine if symptoms persist?
Yes, per protocol/medical direction if symptoms do not improve or recur.
What must an EMT confirm before assisting with a patient's epinephrine autoinjector?
It is prescribed to the patient and the patient is exhibiting anaphylaxis symptoms.
What effect does epinephrine have on bronchioles?
Bronchodilation, easing breathing.
What effect does epinephrine have on blood vessels systemically?
Vasoconstriction, raising blood pressure and reducing swelling/edema.
What brand names are common for epinephrine autoinjectors?
EpiPen, AviQ, and Adrenaclick.
What should be done with the autoinjector after use?
Transport it with the patient to the hospital and note the time given.
Why is epinephrine considered a first-line, time-critical treatment for anaphylaxis?
Delay increases risk of airway obstruction and cardiovascular collapse.
What class of drug is epinephrine?
Sympathomimetic, adrenergic agonist.
What should an EMT do immediately after administering epinephrine for anaphylaxis?
Continue monitoring ABCs, prepare for further doses, and transport promptly.
Why might a second dose of epinephrine be needed?
Its effects are short-lived, 10 to 20 minutes, and symptoms can recur or persist.
What position should be avoided in a hypotensive anaphylaxis patient?
Standing/sitting upright suddenly, prefer supine with legs elevated if tolerated.
What is the indication for albuterol, MDI, administration?
Bronchospasm/wheezing associated with asthma, COPD, or other respiratory distress.
What is the typical dose of albuterol via MDI?
1 to 2 puffs, approximately 90 micrograms per puff, repeated per protocol.
What is the route of administration for albuterol via MDI?
Inhalation.
What is the mechanism of action of albuterol?
Beta-2 adrenergic agonist causing bronchodilation via smooth muscle relaxation in the airways.
Name a contraindication to assisting with albuterol MDI.
Patient unable to inhale/coordinate use, or no physician prescription for the patient.
What device can improve MDI drug delivery for patients who struggle with coordination?
A spacer device.
What side effects can albuterol cause?
Tachycardia, tremors, nervousness, and palpitations.
What must an EMT verify before assisting with a patient's MDI?
It is prescribed to the patient and appropriate for their current symptoms.
How should a patient be coached to use an MDI for best effect?
Exhale fully, seal lips around mouthpiece, inhale deeply while pressing canister, hold breath about 10 seconds.
What is the purpose of shaking an MDI canister before use?
To ensure the medication is evenly mixed/suspended for accurate dosing.
What condition characterized by bronchoconstriction commonly requires albuterol treatment in EMS?
Asthma exacerbation.
Can albuterol be delivered via nebulizer instead of MDI?
Yes, nebulized albuterol is a common alternative delivery method.
What breath sound is commonly associated with the need for albuterol?
Expiratory wheezing.
What class of medication is albuterol?
Bronchodilator, short-acting beta-2 agonist, SABA.
Why might albuterol be less effective if inhalation technique is poor?
Poor technique reduces drug delivery to the lower airways.
What time interval is often used between repeat albuterol doses in EMS protocols?
Every 5 to 20 minutes as needed, per local protocol.
Should albuterol be given to a patient with no prescription and no protocol allowance?
No, without a prescription or protocol/medical direction, it should not be assisted with by an EMT.
What effect does albuterol have on heart rate?
It commonly increases heart rate as a side effect.
What is the onset of action of inhaled albuterol?
Rapid, typically within 5 minutes.
Besides asthma, what other chronic condition commonly involves albuterol use?
COPD, chronic obstructive pulmonary disease.
What is the indication for naloxone administration?
Suspected opioid overdose with respiratory depression.
What is the mechanism of action of naloxone?
Competitive opioid receptor antagonist that displaces opioids from receptors.
What routes can naloxone be administered by EMTs?
Intranasal, IN, is most common for EMT basics, also IM, per protocol/scope.
What is a common intranasal naloxone dose?
4 milligrams per spray, 1 spray per nostril, e.g., Narcan nasal spray.
What are signs of opioid overdose that indicate naloxone use?
Respiratory depression/apnea, pinpoint pupils, and decreased level of consciousness.
What side effect can occur after naloxone reverses an opioid overdose?
Acute opioid withdrawal symptoms, such as agitation, nausea, or combativeness.
Why might repeat doses of naloxone be needed?
Naloxone's duration of action is shorter than many opioids, so resedation can occur.
What is the priority action before/with giving naloxone in an overdose?
Support airway and breathing, ventilation, as needed.
What brand name is commonly associated with naloxone nasal spray?
Narcan.
Is naloxone effective against non-opioid overdoses such as benzodiazepines or stimulants?
No, it specifically reverses opioid effects only.
What contraindication exists for naloxone administration?
Known hypersensitivity/allergy to naloxone, rare, otherwise minimal contraindications.
What should an EMT expect after administering naloxone to an opioid-dependent patient?
Possible sudden agitation, combativeness, or withdrawal symptoms as consciousness returns.
How quickly does intranasal naloxone typically take effect?
Within 2 to 5 minutes.
What is the pupil finding classically associated with opioid overdose?
Meiosis, pinpoint pupils.
What population increasingly carries naloxone for bystander use?
Family/friends of opioid users and community members via take-home naloxone programs.
What should an EMT do if the first dose of naloxone does not improve respirations?
Continue ventilatory support and administer additional doses per protocol.
What class of drug is naloxone?
Opioid antagonist.
Why is naloxone considered very safe even if given when opioids are not actually involved?
It has minimal effect/adverse risk in the absence of opioids in the system.
Can naloxone be given IM by autoinjector device?
Yes, devices like Evzio deliver IM naloxone.
What should be prioritized in an unresponsive patient with suspected opioid overdose besides naloxone?
Airway management and ventilatory support, BVM. Naloxone doesn't replace airway care.
What is the purpose of beta blockers, such as metoprolol or atenolol?
Treat hypertension, angina, and arrhythmias by blocking beta-adrenergic receptors.
What EMS-relevant effect can beta blockers cause that masks the body's compensatory response to shock?
Blunted tachycardic response despite hypotension/shock.
What is the purpose of ACE inhibitors, such as lisinopril or enalapril?
Treat hypertension and heart failure by blocking angiotensin-converting enzyme, causing vasodilation.
What common side effect is associated with ACE inhibitors that EMTs should recognize?
A persistent dry cough, rarely angioedema.
What is the purpose of statins, such as atorvastatin or simvastatin?
Lower cholesterol/LDL to reduce cardiovascular disease risk.
What is the purpose of anticoagulants, such as warfarin, apixaban, or rivaroxaban?
Prevent/treat blood clots by inhibiting the clotting cascade.
Why is anticoagulant use critical information for EMTs in trauma patients?
Increased bleeding risk, including risk of significant intracranial hemorrhage after head trauma.
What is the purpose of antiplatelet drugs, such as clopidogrel?
Prevent platelet aggregation to reduce clot formation, often after cardiac stent placement.
What is the purpose of insulin?
Lower blood glucose by facilitating cellular glucose uptake in diabetic patients.
What EMS emergency can result from too much insulin relative to food or activity?
Hypoglycemia.
What is the purpose of oral hypoglycemic agents, such as metformin or glipizide?
Lower blood glucose in type 2 diabetes management.
What is the purpose of diuretics, such as furosemide, Lasix?
Reduce fluid volume by increasing urine output, used for hypertension and heart failure/pulmonary edema.
What electrolyte imbalance is a concern with diuretic use?
Hypokalemia, low potassium.
What is the purpose of chronic bronchodilator inhalers, such as ipratropium or tiotropium?
Maintain airway patency in COPD/asthma by relaxing bronchial smooth muscle.
What is the purpose of anticonvulsants, such as phenytoin or levetiracetam?
Prevent or control seizures.
What is the purpose of benzodiazepines, such as diazepam or alprazolam, as home medications?
Treat anxiety, seizures, or insomnia by enhancing GABA activity as a CNS depressant.
What is a risk of combining opioids and benzodiazepines?
Significantly increased risk of respiratory depression.
What is the purpose of antihistamines, such as diphenhydramine?
Block histamine receptors to relieve allergic symptoms.
What is the purpose of corticosteroids, such as prednisone?
Reduce inflammation, used for asthma/COPD exacerbations, allergic reactions, and autoimmune conditions.
What is the purpose of antidepressants, such as SSRIs like sertraline?
Treat depression/anxiety by increasing serotonin availability in the brain.
What EMS concern is associated with tricyclic antidepressant, TCA, overdose?
Cardiac dysrhythmias and seizures, a serious toxicological emergency.
What is the purpose of antipsychotic medications, such as risperidone or haloperidol?
Manage psychotic symptoms/schizophrenia or severe agitation by blocking dopamine receptors.
What is the purpose of erectile dysfunction medications, such as sildenafil, Viagra, relevant to EMS drug interactions?
They potentiate nitrate-induced hypotension, making nitroglycerin administration dangerous if recently used.